Hey everyone, it's Injector Chris. I'm here with my friend Max Connor.
Hello.
And we're going to do some Botox today, so stay tuned. Alright, so we're going to do a general assessment for toxin in terms of like what we're looking for, landmarks, and what muscles we're treating. Alright, so when you elevate your forehead, do that for me, like move the muscle. Yep. So this is the frontalis here. Everyone pulls out to a different point, but this muscle is responsible for elevating the face. His stops right around here. Now, when a man has a shaved head, you have to think about multiple things. You have to think about the compensatory muscles on the lateral aspect. So if you relax your face and then pull up for me, you see that movement here in the temple? You can't ignore that, because if you were to treat the frontalis here and not treat the temple here, you will have limited movement here, which will look really nice, but this muscle is going to be much more amplified. You're going to see it pulling back because now it's compensating for the movement in the frontalis. So we have to make sure we address this muscle as well. That way everything looks balanced and harmonious. So now make an angry face for me. This is the glabellar complex. It consists of two muscle groups, the corrugators on the sides and then the processor in the center. This muscle group is responsible for pulling the face down. These two muscles always should be treated together, the frontalis and the glabellar complex. And the reason for that is because you want things to be balanced and harmonized. It'd be very awkward if you were walking around unable to pull your face down, and all of a sudden the muscles that pull the face up are very exaggerated. It can look very bizarre. So I always treat the muscle groups together, full upper third of the face, so things are balanced. Now when we smile really big for me, do that. So this is the orbiculus oculi. It's a sphincter muscle that goes around the eye. It's a giant circle that squeezes in and out. So when you inject the lateral portions of it, it helps to kind of keep the eye a little bit more open and fresh. And so what I also do, if you can see here, we have a little bit of a jelly roll underneath the eye. So I do a micro droplet technique of just 2 units all throughout this little area to kind of help open up the eye underneath as well, just to help freshen up the skin. It helps with some of the crepiness that we can sometimes experience here. And that's something, if you were to relax and not smile, he doesn't really have that at rest, you know? So it just kind of helps to freshen up the skin that is pulling on that area, that kind of gives us more of that textured look. So it just keeps it refreshed. Now what I also do, so scrunch up your nose for me. Yeah, so this is the nasalis. A lot of people who have been doing toxin for a while and haven't been treating this area tend to get a stronger nasalis. And the reason for that is because this muscle will compensate for the movement that you're not able to do once you treat the glabella. Once you treat the glabella, you're no longer able to make an angry, scrunched up face. You will start using your nasalis more. Relax. And what that can do for some people at rest, over time, the nasalis can bulk up and actually make their nose look wider, because that muscle is now starting to get bulked up because it's being used so much more often because the glabella is not being used anymore. So whenever I'm doing someone's upper third of the face, even if they don't have a lot of movement here, I am doing small little droplets over here so that muscle doesn't bulk up on you. It's just really important to keep everything balanced in the full upper third of the face.